Rachel, thank you. We're on your side tonight with the latest testing stats across the state of North Carolina. The Department of Health and Human Services updates their data every morning. So the latest we have right now is that 20,000 people have been tested in the state. Now, of those tests, more than 1,300 have come back positive. 6 people have died, and more than 100 people are currently right now in the hospital. Now, all the medical experts recognize, though, more testing still needs to be done. Tryon Medical Partners has been running 2 testing sites for its patients here in the Charlotte area. One is in Matthews and the other's just outside of Uptown. So how is it going? Earlier today, I got a chance to talk to Dr. Ryan Shelton.
So it's the same folks who are doing this day in and day out. They have volunteered to do this. So they've gotten very good at evaluating patients. So this is more than just drive-by testing. It's an evaluation. So you're going to be seen by the nurse and the doctor to kind of size up, okay, what are your symptoms currently? Do we need to rule out flu? Could it be something else infectious? And then we would perform the COVID testing. And there are 5 different bacterial infections that can commonly cause respiratory infections or a pneumonia that the test is able to tell us, could it be that? So that would then, change the treatment plan significantly. And we're seeing that a lot of times people will have a double infection.
Are we to that point, doctor, where everyone who really needs a test is able to get one now, or are you still having to sort of triage those?
I mean, we're definitely still triaging people. If people have super mild symptoms, it may not be necessary to test them. So as, maybe unrewarding as it may seem, for a lot of folks, we have to just assume you have it. And that may be the better thing to do. And that's basically the recommendation kind of stays the same. You go home, you self-quarantine, you monitor your symptoms, and you try to, prevent the spread.
But doesn't it change how they are sort of treated when it comes to what the county is telling you to do? I know you're asking people, right, to self-quarantine if it's a possibility, but if you get the actual positive test, that kind of puts you in a different category, doesn't it?
It just puts it in that it's confirmed. So we notify, the lab notifies the county health department, as do we, as well as the patient, instantly. Obviously it is preferable to know the answer. Sure. And it does, hopefully people will take that a lot more seriously if they do know the true, positive once it's confirmed. But I will say there can be some false negatives. So we try to treat the whole picture. We treat each patient and not just a result. So yes, it does change in terms of, once you get the positive test, then we know you need to be at home for either 7 days from the start of your symptoms, plus 3 days until you have no fever, on no medication, and no other symptoms. So that's when it's safe to kind of know that you've, cleared the illness.
How maddening, how difficult is it, though, for you? Because we keep hearing about those who are asymptomatic. They're carrying it. They don't know they're carrying it.
That's tough. It could be, you and I could be carrying it right now and haven't developed anything. We just have to go on the numbers that we've, what we've learned from other places so far. And the average time before symptoms would develop is about 5 days, but it can be anywhere from 2 to 14 days. So it certainly can incubate, quite a bit longer. Luckily, the average is about 5 days.
Yeah.
So again, it kind of goes back to, that's why we're all staying home. We're really trying to prevent the spread.
Well, since we had him, we also took the opportunity to ask Dr. Shelton a couple of good questions that you have been sending in about COVID-19. Melinda emailed us asking, what can we use to clean and kill the virus, since there is often no stock available of Lysol, Clorox wipes, etc.? Are there any home remedies to use? Here's Dr. Shelton.
There's good old soap and warm water. That will work to wash our hands constantly. That's key. But for wiping surfaces at home, you could make your own bleach. So 1 part bleach to 9 parts water. So that's basically your own cleaning solution for home. So, I mean, I do feel like we can adapt a little bit and do that. But the more we wash our hands, the better. That way, in case we are touching a surface that wasn't cleaned, it's less likely to be on our hands. And it's near impossible to not touch your face. I mean, we just naturally do that. So the higher yield thing is really to clean the surface as best we can with whatever we can, including soap and water, and to wash our hands.
Now, quite a few of you have been sending in questions about masks, so let me just sort of try to put them all together for you. Remember early on, we were discouraged from wearing them. So was that because they aren't effective or because they were in short supply? And then is there something we can use at home as an alternative?
So, initially, yes, it's really more about preserving supply for those who are really on the front lines who truly need it. We have to preserve our healthcare workforce. We have to be able to take care of the sick patients when that happens. So that's a huge part of it. This new virus is spread by respiratory droplets. So it's in about a 6 feet area that we could cough, and those particles can float a bit and before they land on a surface. So that might be about 30 minutes they can be suspended. So anything that we can block, will help some, but some of the particles are so small they could maybe get through some of the porous, blockade. Mm-hmm. That's why we have special masks that are the preference, but of course those we have to preserve those.
So is that to say, like a bandana, it's not going to be 100% foolproof, but maybe it gives you a little bit of added protection?
Correct. I think that's fair. I think a bandana, it's not going to be, as protective as the N95 respirator mask, but it still would be better than nothing, both at what you might project or spread to others.
Some great information from Dr. Shelton. If you have a good question, send it to us. We'll work to get you an answer. Use the hashtag OYS Tonight on Twitter or email askjamie@WBTV.com.